Good morning, my respected teacher. As a medical student, I'm deeply interested in the topic of the meningitis because meningitis is an acute disease that can lead severe neurological sequelae. In a case 2 years ago, my cousin had prolonged fever and mental disorder. Fortunately, I detected it in time and took him to the hospital for treatment, and he survived through the critical stay. Therefore, I'm very interested in this meningitis disease. The presentation today I will divide into four sections. Part 1, general information about the disease. Part 2, that is symptom, and Part 3, I will discuss the diagnosis, and finally there are treatment options. Now let's move on to the main content. In Part 1, general information about the disease. And what is the definition of the meningitis? Meningitis is an infection of the protective membrane that surrounds the brain and spinal cord. Meninges are three layers of membrane that cover and protect your brain and spinal cord. They are known as in this image diameter. This is the outer layer closest to your skull, and aphronoismeter, this is the middle of layer, and the diameter, this is the inner layer closest to your brain tissue. More especially, it refers to inflammation of the two inner layers, which are called lateral meninges. It can affect anyone, but is commonly in children. To but it commonly in baby to children, teenager or the older. Meningitis can be very serious if not quickly treatment. It can lead to the mental disorder, and this image you can see many children with um, several species, and this image a children with epilepsy and even deaf. The two main causes of meningitis are the virus and bacteria. On this slide, you can see the name of the bacteria and viral pathogen. For example, Streptococcus pneumonia, Escherichia meningitis, Haemophilus influenza, or the poliovirus, Coxsackie virus. It can be caused by virus, bacteria, or fungi, or the parasites. Can be lead to meningitis. However, there are some causes of non-infectious meningitis, such as systemic lupus erythematosus, secondary head injury, or brain surgery. On this slide, I will discuss about the signs and symptoms of the disease. There are many symptoms of the meningitis. However, the most common symptoms are fever, headache, sensitivity to light. It's also called photophobia. And this image, you can see a man with a nausea or vomiting. And finally, patient with meningitis can be confusion or enter mental state. Firstly, fever. Uh, their fever is the most common symptom of the meningitis. A high fever, usually over 100 degrees Fahrenheit or 38.9 Celsius. HA. A, a severe HA is another common symptom of the meningitis. The HA may be broken or constant. It may be brought when laying down or bending over. On this slide, you can see the patient with um, stiffness. This is a classic symptom of meningitis, but it does not occur in a case. A stiffness can make it difficult to touch your chin to your chest. On this slide, a man who is sensitive to light is also called photophobia. A patient have meningitis can be nausea or vomiting. Nausea often describes feelings like your mind blow up, and vomiting is the forceful impulsion of the stomach content to the mouth and sometimes the nose. And finally, patients have meningitis can be under mental state. Part 3. Diagnosis. The clinical diagnosis of meningitis include talking on history, epidemiology, investigation, and physical examination. Furthermore, meningitis tests are essential tools for diagnosis of the disease. Epidemiology and history. Physicians can ask a patient to the history of the head injury or breast surgeries. However, there are currently a large number of people with meningitis. The patient can be contacted with a person who has meningococcal disease or recurrent ear, nose, and throat infection in the patient. In clinical, the physician can may find out the systemic inflammatory response syndrome. Besides this, meningitis syndrome is about HA, vomiting, and constipation, stiffness, positive cognizant and routine key sign, and finally confusion or mental state. Cerebral spinal blues is also called CS blues. CS blues protein glucose and lactate give an indication as to the etiology of the meningitis, but are not definitive. There are some characteristics of the CS blues. For example, the appearance tubes protein have increased. The blood culture have decreased. Less more than 50% of simultaneous obtain blood glucose, and the cell growth increase, usually thousands of cells per cubic millimeter. Lactate increase, more than 4 millimole per liter. Microscopy and culture may detect the causative bacteria. On this slide, uh, they are the way the physician take CS plus through the lumbar puncture procedure. And this image, the CS plus, the tube is CS plus. There are some other tests for diagnosis meningitis. Blood test is free white blood cell. Neutrophils are the main type of white blood cell. Blood culture suggests causative agent, and classic agglutination test can help to quickly identify the type of agent. However, CT scan or MRI often doesn't detect the disease. And now I will discuss the path for there are treatment options. The antibiotics are the first line treatment for meningitis. Intravenous administration is necessary during the acute stage of the disease. The principle of using antibiotics are only used immediately upon diagnosis. Should be used bactericidal antibiotics, intravenous hydronodal reduction during treatment. Selection of antibiotics based on pathogen and antiviral. Broad-spectrum antibiotics should be chosen when the pathogen is not yet identified. Cephalosporin of the third generation are the antibiotics of first choice and cetirizine cefotaxime. And in addition, intravenous vancomycin should be used in combination. The usual duration of antibiotic treatment is 10 to 14 days, depending on the clinical course of cerebrospinal fluid finding. And on this slide, I will discuss about the substitute treatment. There are many ways to treatment to favor treatment. I prefer to rely for reduce favors. Firstly, physician can indicate the medicine as paracetamol or ibuprofen. Second way, patients should drink plenty of water. Besides, apply in a warm compress. A patient has respiratory failure. A patient should use oxygen when they have shortness of breath. If coma scale less than 9, consider endotracheal intubation. And this slide, what is the cerebral edema? Its definition is a condition that occurs when blood builds up around the brain cell. It can cause up the brain to swell and lose pressure on the skull. And here that is the two images describe the cerebral edema on CT scan. Besides this, there are some medicine to treat cerebral edema. Corticosteroids such as dexamethasone can be administered intravenously. In addition, diuretics such as furosemide uh, or, uh, has elevation and oxygen can be treated cerebral edema. Sufficient nutrition helps to a healthy body, strong immunity, and rapidly to recovery. Close-ups. In conclusion, meningitis is a dangerous disease, so it's important to note the following key points. Firstly, meningitis is an infection of the protective membranes that surround the brain and spinal cord. It can affect anyone, but is more common in baby, young children, teenagers, and the older. Thirdly, meningitis can be very serious if not quickly treatment. Fourthly, there are many symptoms of the meningitis, and finally, patients should be admitted to the hospital as soon as possible. Thank you for your attention.